Hi, Whole Health Revolutionaries. It's Dr. Marc back here. I've had a question coming in recently about the different causes of headache. So it's a huge topic. We're going to go through it very, very quickly. The main thing to think about is that headaches are basically linked to the organs within the head, and they're what are going to cause headaches. So the most obvious thing to consider when anyone's got a headache is dehydration. So lack of water. The brain is massively made up of water. If you haven't drunk enough, if you've been drinking alcohol or you just haven't been drinking enough water after exercise, you may well develop a headache. So lack of water, dehydration is one of the main causes of headache. Second cause of headache is high blood pressure. So if for whatever reason you're stressed, you're anxious, you've got cardiovascular insufficiency, you've been exercising a lot without warming down, therefore bringing your blood pressure and heart rate down gradually, you stop exercising, your heart rate stays up, that'll also give you a headache, okay? Other things to consider when thinking about headaches are obviously growths within the head, so intracranial masses, cancers, tumours within the head, but those are pretty rare. We don't want to think about those being any kind of issue here. Okay, next thing to consider, if we start from the bottom and work our way up, headaches are often caused by either a compression of the facet joints in the neck, so the upper vertebra in the neck can end up compressed due to bad sleeping positions, due to bad computer positioning. So depending on where they refer to, which from the back of the neck really tends to refer to the temples there, those sort of headaches, if they're aggravated by moving your neck, can realistically be as a result of a facet joint compression in the neck. Okay. Moving on from there, you can also compress the arteries, the vertebrobasilar artery to the neck, through the neck into the brain, and this can give you some dizziness, visual disturbances, and headaches as well. So you need to make sure that your neck is nicely lengthened and isn't hyperextended. See a really good osteopath, chiropractor, get that dealt with if there's an issue there. Okay, then as we go up into the jaw, yeah, so you're going to get the cervical ganglion change of glands, and all of the other glands around the neck. So if you've got inflammation of the glands fighting an infection, they can also give you headache, as can an abscess in the tooth. So make sure your teeth are well looked after. Sinus problems, okay, so above the eyebrow and around the nose, sinus problems due to drug use, infection, poor sinus drainage, basically, they'll also refer to the head and give you a headache. Problems with the ears, so any kind of eustachian tube blockage or pain or inflammation will refer to the head as well, as will poor vision. So make sure you got the right glasses on if you need them. Make sure one eye isn't stronger than the other, and if it is, have that corrected, because the eyes will also give you headaches. Okay. Finally, if you wear braces, you grind your teeth due to chewing gum or stress, you will actually get tightening of the muscles around the head, so the muscles of the scalp themselves, yeah, the temporalis and masseter muscles that involve that chewing and tightness of the jaw, they themselves can get ischemic, it's called, where there's not enough blood in them because they become so contracted and so tight, and you can have a headache due to the muscles in the head. Okay, I think that's most of the things that we've covered with headaches. If you get any of the above, go and see your physician first and foremost, okay? He should be able to differentiate one from the other. Keep safe, keep healthy, no need to live with headaches, get it treated, but most of all, drink water, that'll cure 80% of them. Over and out, boom.